Hello everyone, welcome back to the channel. This is Dr. J. This is a real short, quick ear cleaning for you. This patient had presented to me for hearing loss, and once we were able to examine his ear, it was very clear that his hearing loss was secondary or caused by a wax plug that was on the outer part of his ear canal. And as you see here, the hook that I use, we tried to find a way around it, but it was completely obstructing the canal. And as we work our way around it, we can try and, from the margins, try and push it towards the middle. And you can see I'm actually bending the hook here. I was applying a lot of force. At that point, it starts to become uncomfortable for the patient. So I lighten up on the force, and I try and find a new angle, a new avenue to get around it. And the patient was fortunately very tolerant of this process. Here you see we pulled up on the wax plug, and it's attached to it is some scaly epithelium or keratinous debris, and it had been blocked for so long that the skin was no longer able to migrate out of the ear canal, and that's what you see lifting up there a moment ago. We come towards the superior or the upper part of the canal and try and work our way down. Again, we're just trying to get enough of a grip on this that it can get removed. The wax was hard, but not hard enough that the hook wouldn't pull through it. And so it never hurts to try again. And so we can see we're working towards the front of the canal again. And we're starting to get some good movement of this cerumen and keratin plug. And this is not a case of keratosis obturans because there's no canal wall deformity or transformation of the ear canal wall. Here we could see deeper, and I was able to get a deeper purchase on the wax plug, and there we're able to pull it out. And at this point, we just remove the ear speculum, and once we were able to do that, it just comes all out in one piece, which makes the job real nice and easy when it comes out that way. And the speculum, as we slide it out, is actually attached to the speculum. You can see it's dark, it's oxidized, it's been in there for a while, and all intact. It all came out in one piece. That's great. And there's the normal eardrum. His hearing loss was cured. Appreciate you guys for watching, and you guys have a great day. We'll see you on the next video.